like to introduce our next speaker, Pammie Ellem. And Pammie is talking to us about her abstract Telehealth, reducing the tyranny of distance for health professionals working in regional and remote Queensland. Please welcome Pammie.
Thank you, everyone. Good morning. I would just like to acknowledge the traditional owners, both past, present and future, of the land upon which we stand. I'd also like to acknowledge the Breast and Prostate Cancer Association of Queensland for their generous sponsorship towards this study. I'd like to acknowledge the Central Queensland University, my supervisors, Dr. Wendy Madsen and Dr. Linda DeGeorge Walker, who are always there to offer me amazing support. And the study certainly wouldn't have been possible without the dedication, cooperation and enthusiasm of the wonderful specialist breast care nurses, the peers in my study. I thank them very much for sharing this journey with me. And I thank the organisers of this conference and Telehealth Queensland for enabling me to combine two passions together. I feel very fortunate to be able to have done that. I wear many hats, as I'm sure we all do. First and foremost, I come before you today as a health professional who is passionate about delivering services to rural communities and supporting those that work there, as I myself grew up in a picturesque, rural, isolated area of Queensland. And I thank Pauline and Lee for showing a photo of my most favourite hospital that I worked in for 7 years. I'm employed as a telehealth coordinator in the Wide Bay, bringing services to isolated communities and at the same time bringing health professionals together. As Mike Horan so simply put it this morning, bringing country, city and technology together. Additionally, I'm also a credentialed cancer care nurse completing a PhD, about to go grey, to develop a model of support for specialist breast care nurses in regional and rural Queensland. So as telehealth coordinator, I recognise the ability to bring people together with relevant ease, although we all experience that resistance at some stage, in a meaningful way, to increase our knowledge through shared experience and listen to lectures or even observe others providing health services, as was just illustrated to us. As a specialist breast care nurse, I recognise the need to bring these niche specialists together on a regular basis for professional support, including peer networking, enhancing seamless care for patients, and being able to access further education. Hence, this study was developed. So my aims of this presentation, through a collaborative study with 9 other specialist breast care nurses, I'll provide a background to the study, followed by a brief description of methodology, highlight the use of telehealth to connect the isolated health professionals together, thereby increasing their peer support and patient care, demonstrate the ability to reduce isolation, which may be geographical, technical or professional, and increase professional development opportunities. The background of this study is that breast care nurses are really well recognised, as I'm sure you probably all agree, for the role in their treatment of women experiencing breast cancer. However, there's little research undertaken to contribute to the support of the specialist breast care nurses who often work in professional, geographical and technical isolation. Black and Farmer said in 2013, specialist cancer nurses working at an advanced level require support not only to undertake professional development and maintain their level of competency, but to prevent emotional burnout, which I'm sure is a phrase we've all heard. Black and Farmer went on to recommend the uptake of strategies to train, support and retain cancer nurses, including specialist breast care nurses. To date, there's been limited work in that area, unfortunately, with only an ad hoc approach and very isolated studies. This is reflective of what the nurses in this study have experienced. Hence, this study is of great importance as a way of overcoming this well-recognised gap in support of not only specialist breast care nurses, I might be a bit biased, and specialist cancer care, but all healthcare professionals working in isolation. This research will contribute to the professional support of specialist breast care nurses beyond the area of further education. It needs to include and will peer support and clinical supervision as well as further education. So with the methodology, using a combination of participatory action research, hence my 9 participants, and communities of practice, through action research cycles, we've strived to develop a sustainable model of support for specialist breast care nurses, which is transferable, as I've suggested, to other streams of isolated health professionals, mental health workers, academics, physios, the list is infinitum. Participatory action research and communities of practice share a baseline principles of democratic participation, shared interest in a particular subject, striving to make change through increased knowledge and participation, and voluntary association. So over a period of 18 months and 3 action cycles were completed, data was collected, collated, analysed to identify key themes. The data included quotes from semi-structured interviews, informal conversations, minutes of meetings, you get the picture, it goes on, using background literature and job descriptions even. And 3 main themes emerged: isolation, challenges, and specialist breast care nurse support. So from here, we've gone on to develop a model of professional support incorporating the use of telehealth, incorporating my interests, and phone and face-to-face meetings. So from the 3 major themes of isolation, challenges, and specialist breast care nurse support, as previously said, the specialist breast care nurses identified 3 elements. It kept coming up over and over again: trusted peer networks, education, and professionalism. With these 3 elements combined, it was determined that we would then have competent and confident specialist breast care nurses, providing improved care to patients and their families experiencing breast cancer in regional, rural, and remote Queensland. So this diagram represents 2 health regions that work together to provide care for breast cancer patients and their families. There's over 409,000 square kilometres, representing 390,000 people. As you can see from the diagram, there's a good number of breast care nurses. However, there's no formal connections between them because of the different employers, which you can see, NGO 1, NGO 2, we're all disconnected, which leads to fractioning of the service delivery. Therefore, if the specialist breast care nurses come together voluntarily as a support group, they are able to have regular communication and provide seamless care to patients as they are connected. Wenger, who's one of the famous authors for communities of practice, suggests that the values of community of practice is to coordinate and connect the previously unconnected activities, which in this case is specialist breast care nurses. But I urge you to think of your own specialties. So the model of professional support for breast care nurses is moving on from the data analysis. So where is this leading, and why do we need a 3-year study? Or, as Anne so aptly put this morning, just common sense, as it's suggested. The model of professional support is not rocket science. However, it contains 3 elements that are identified by the nurses, which is professionalism, networking, and education. So the key to this model, as I've just said, and I repeat again, is it's connecting the previously unconnected. The role of the specialist breast care nurse has been identified not only by nurses in this study, but by many authors as ambiguous. Having the role clearly defined and understanding the differences due to our geographical locations, for example, Barcaldine and Toowoomba, really assists in establishing professionalism and respect of each other in this group. Professional growth comes from respecting one another in the different roles and connecting regularly. Telehealth has assisted in this process. Competencies also were identified by these nurses as being quite out of date, and it's been identified by Jones in 2010 and Ahern and Gardner in 2015. And I wrote with an exclamation mark, maybe that's our next study, if I have any hair left. Education and knowledge is developed through the model of professional support by meeting, and the meeting having a strong structure to include in education, case conferencing, literature reviews and peer support. The meetings attract recognised CPE points due to its structure. There's presentations at some of the meetings, and the community of practice philosophy encourages shared peer education and shared knowledge, which really strengthens the group. Telehealth has enabled nurses in rural and remote to join the table collaboratively with their colleagues on a monthly basis. And networking, as we are all aware, and what we're doing today as well, is an essential part of a model of professional support for specialist breast care nurses. Peers who network regularly with a purpose get to know and trust one another. They build a rapport and they build confidence. That increases referral patterns and assists in the delivery of seamless care to patients across the health districts when formal structures are not present. The use of telehealth has enabled this to happen over our vast state, combating the problem of distance. So now, thanks to telehealth, we have competent and confident specialist breast care nurses delivering increased patient care. The meeting structure commenced with monthly face-to-face meetings, but as you can imagine, if you're the 6 to 8 hour away nurse, it's pretty hard to keep that up, particularly on a voluntary basis. We were able to introduce SIVO, which is the university version of telehealth, and then gradually we're able to introduce telehealth to these meetings and telephone or dial-in. So it has now been resolved, those who wish to travel may, those who wish to dial in may, and some, in other words, attendance is still voluntary, and the medium that each specialist breast care nurse attends, prefers to attend, they may. Some alter from face-to-face to telehealth to telephone, depending on where they are. But they all have built this trust and rapport and are regular attendees. Furthermore, some of my most resistant telehealth nurses are now using telehealth for patient consultations. So it's a win-win. So here we are in a telehealth session. A journey of empowerment, growth, trust and support. From face-to-face meetings to now including telehealth to bridge the gap of our rural colleagues who wish to play such an important part in their patients' welfare. The regions of specialist breast care nurses are now working together very effectively and efficiently. But a simple, effective model of care for specialist breast care nurses is now developed and running. Specialist breast care nurses in a larger metropolitan area have adopted this model as well in the last 12 months. So it is our hope that specialist breast care nurses and all other isolated health professionals can adopt this model of professional support, enabling them to grow in strength, support each other and therefore contribute to improved care, if not only of themselves, but definitely for the patients and their families. The tyranny of distance is bridged with technology, or telehealth, trust and support. Thank you for listening, and please do not hesitate to go home and start your own regional support network. Thank you.